Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan and today we are going to discuss some of the other conditions in which the patient can land up in the pulmonary emergency departments. We've already gone through the specific conditions of asthma and chronic obstructive pulmonary diseases. These are some of the common conditions in which we have the pulmonary emergencies and we are well versed with how to deal with such conditions. Now, in this particular lecture, we'll be focusing on some of the other miscellaneous conditions. For instance, we have the pulmonary arterial hypertension, as well as we'd be going through the details of pulmonary embolism. How does it occur? What are the causative factors? And how do you treat these patients? That would be discussed in detail over here in this particular lecture. So moving on, we have the definition of acute pulmonary embolism. What is the criteria, the three basic significant factors on which we diagnose a patient to be suffering from this particular condition? What are the essentials of diagnosis, including tachypnea, that is the increase in the respiratory rate, and then we have tachycardia, which is basically an increase in the heart rate. So these are the particular clinical features that we'll be discussing in detail over here. Moving on, the treatment guidelines. So there are specific decisions as an intensivist that you have to make on the spot. So it is going to depend upon the condition of the patient, how critical the patient is, that you would be focusing on the supportive therapy, and then you can also intervene in between through the surgical managements, as well as a lot of medicines can also be used. So the decisions basically rely upon the condition, the overall condition, including the clinical signs. And then obviously some of the factors in the history are also taken into account. For instance, if the patient has right ventricular dysfunction, that is also taken into account over here. So all of these things are taken into account. Then we'd be moving on with another important condition. We'd be discussing the definition of hemoptysis over here. Moving on, and another condition, which is basically the pulmonary arterial hypertension. We don't know the exact causes towards the development of it, but we'd be discussing the diagnostic criteria. And along with that, we'd be moving on with a very important condition called pneumothorax, going on with the definition, the clinical features, and moving on with the treatment guidelines that are subdued to this kind of a condition. Then we have pneumomediastinum that we'd be discussing in detail along with its signs and symptoms. Pleural effusion would be discussed in detail over here along with its treatment and clinical features. So you can watch this lecture as well as a variety of other lectures by subscribing to sqadia.com, and you can even start your free trial right now. Thank you for watching sqadia.com.